I'm just going to take another moment to say kind of what all the other speakers have noted, that it's very exciting and I think a sign of just how important global mental health is and how we're realizing that. I'm a recent addition to the research field, and I actually came with domestic training and started reading about some of the treatment gaps and just the burden of disease globally and got interested from there. So when you were talking about a training program for that, I was like, that's amazing, that's wonderful. So very excited to be able to speak to you guys today. I'm actually going to talk about a specific research study that we conducted looking at psychological distress in Ghana and its associations with employment and lost productivity. So a few familiar statements that mental health is a huge global priority. We see that over 450 million people are affected, which represents about 13% of the overall global burden of disease. Now, the numbers are a little more staggering when you look that 3/4 of those people are in low and lower middle income countries. But the problem is that these countries are both understaffed and under-budgeted to address this concern. So we wanted to look at one specific aspect, the relationship between psychological distress and employment. Well, as you might note, the research evaluating this relationship, specifically in sub-Saharan Africa, is quite limited. We see that there are a small number of studies, that they use disparate samples, and that they've had inconsistent results. Now you might say, well, why should we look at Ghana? Ghana represents a good country in which to look at this relationship because, first of all, we were able to get a nationally representative data set. It's always nice to have that numbers to look at. And they recently passed a mental health bill where they talked about addressing access to and the quality of mental health services throughout the country. So specifically in our study, we sought to do two things. We wanted to examine the association between employment and psychological distress among Ghanaian adults. And we wanted to explore the relationship between psychological distress and lost productivity. So what did we use? We used data from the Ghana Socioeconomic Panel Survey, which is a partnership between Yale University and the University of Ghana. And what they did was they conducted face-to-face interviews in 2009 and 2010 with over 5,000 households throughout the entire country. Their survey goal was to monitor the living standards and economic conditions in the country and eventually to have repeated surveys so that they could see how that changes over time. For our specific analysis, first of all, we excluded some categories. We were looking at working, so we didn't want to have individuals that were younger than 18. We didn't want people that were out of the workforce or not looking for work, which would include homemakers or people that had disability that kept them from working. And we didn't want individuals who were missing data on our covariates. So that would be some of the socio-demographic variables, age, marital status, education. We had a final response rate of 85%. Not too bad. And our sample was about 5,400 individuals. So what did we look at? Well, our primary independent variable was something called the Kessler Psychological Distress Scale, or for short, K10. And that's a combined measure of depression and anxiety. It is a validated survey item, and it has been used in multiple contexts, including low-income countries. Now, the score is, it's a summary score based on 10 questions that range from 10 to 50, and it asks, over the past 28 days, 4 weeks, how often have you had feelings such as, we'll say, nervousness, helplessness, depression, and those can range from none of the time to all of the time. We collapsed it into three levels. Individuals who were well or had mild psychological distress, so what Judith noted earlier, just a few symptoms, but not many. Individuals that had moderate psychological distress, and then individuals with severe psych distress. We used two main dependent variables corresponding to our aims. The first was employment status. So individuals were categorized as being employed if they were working either outside of the home or if they were working on a household farm or a household non-farm enterprise. individuals were classified as being unemployed if they were currently not working and either actively seeking work or they weren't seeking work because they believed none to be available. Our other dependent variable that we looked at was lost productivity, and that was a combination of excess unemployment and excess absence from work. So I'm going to go into how we actually measure that because it's a complicated variable. So immediately following that K10 items, 2 questions were asked about absence from work over the past 28 days. So they asked first, how many days were you totally unable to work because of these feelings of distress that you just reported? And then aside from these days, how many days were you able to work, but you had to cut down on what you did because of these feelings? So I like to talk about quantifying things. So in terms of those days where people were forced to cut down, we counted it as half a day of work. So as I said, for lost productivity, we combined 2 things. We combined excess unemployment and excess absence from work. So what does that represent? Well, excess unemployment was the difference in unemployment rates for those people that had severe or moderate distress compared with those people that were well or had mild distress. And then excess absence from work, following the same pattern, was those difference in the mean number of days they were forced to either not work or cut down on their work for severe and moderate distress compared with those that had mild or no distress. Okay, so what did we find? Well, going back to that first aim where we wanted to look at the relationship between employment status and psychological distress, we found that among people with moderate distress made up about 13% of our sample, and people with severe distress made up an additional over 7%. We also found that unemployment rates here, you can see that as you go through the distress levels becoming more distressed, you have an increasing proportion of the population that's unemployed. So that makes sense, right? Yeah. So the next thing we did was we ran regressions and we looked at the adjusted association between employment and psych distress. And I just want to note that we did control for sociodemographic covariates listed at the bottom, but the big ones that you would think to control for: age, marital status, education, health, religion, wealth, and the region of the country in which people resided. So what did we find? Well, the first thing we found is that people with moderate distress were about twice as likely to be unemployed compared with those that were well or had mild distress. But then when we looked at the relationship for severe versus mild distress, we found that those results differed significantly by gender. So men were over 12 times as likely to be unemployed if they had severe distress, while women, smaller but still high, were almost 4 times as likely to be unemployed if they had distress severe distress, compared with those that were mild or well. So then the next thing we looked at was that relationship with lost productivity. So as I noted, it was a combination of 2 elements, the first being excess unemployment. So what we did is we found the number of individuals unemployed, got the percent, and then got the excess percent. So in order to get this full-time equivalent, which corresponded to one person's contribution to the workforce, we multiplied the excess percent unemployed times the number of people in each level of psychological distress. So you would get 11 times 700 would give you about 78 full-time equivalents. So we found that excess unemployment in our sample accounted for the full-time equivalent of 179 individuals. So the next element of the lost productivity was looking at excess absence from work. So again, we followed that same structure where we found the total days affected over the past 28 days. Use that to get the percent absent from work, and then found the excess percentage, which we multiplied by the number of individuals working within each of these psychological distress categories to get our full-time equivalent of 41 individuals. So then we summed all those values for excess unemployment, excess absence from work, for moderate and severe distress. In our sample, we found that that accounted for the full-time equivalent of 220 individuals. Okay, so let's just take a step back. What does that mean? Let's kind of extrapolate it to the entire population of Ghana. Well, these combined losses could represent nearly 20% of individuals living in Ghana with moderate or severe distress. And if you wanted to think about it in terms of raw number of people, that's potentially nearly 550,000, a sizable number. So, being that we were talking about unemployment, one other element to consider is, what do you think might be the economic effect of this loss in productivity? So we found that the lost productivity due to moderate and severe psychological distress represented a loss of approximately 7% of potential gross domestic product in Ghana. Which, I don't know if, like, when I first heard that, I was like, is that a big number? But for comparison, that is far greater than the estimated GDP impact of a disease like malaria, which when we think of countries like Ghana and stuff, malaria, it's a huge problem, so it's a much greater impact. So, as with any research study, though we are excited about the results, we have to note that there are some limitations to our study. We assessed association and not causality. So we can't say, oh, okay, if you fix employment, if you fix mental health, then employment will be great. Ghana will make all the money it needs, everything will be fine. We can't say that. We'd like to. The other thing to note is that we didn't measure the working environments. There is the potential that individuals in a very stressful working environment could have higher levels of psych distress. So you can't rule that out as a possibility. Another thing to note is that although our GDP estimates are interesting, they are based off extrapolations to the entire population from our study, and so they are speculative. They are by no means definitive. There is also the potential for response bias. We had an 85% response rate, which is not bad, but we did find that responders and non-responders differed by some of our socio-demographic covariates. However, we controlled for them in our models as an attempt to mitigate this concern. So what can we pull away from this? Well, there is a strong positive association between psychological distress and unemployment in Ghana. Specifically, if you recall, men with severe psychological distress were over 12 times as likely to be unemployed. Additionally, even among those working individuals, psychological distress accounted for a substantial reduction in their work and could potentially affect nearly 550,000 people in Ghana. I think one thing that probably everyone here will agree is that it does point to the fact that it's important to address these mental health issues in low-income countries, and that for ours, even though it was an association study, we found such strong results. So that speaks to looking at further, more rigorous trials for interventions, quality improvement to look at this problem. I'd like to give that was quick, special thanks to my co-authors. If anyone is interested, I do have the manuscript for the study that goes into much more detail.